Okay, so what is traumatic brain injury? We talk about wartime trauma, okay, bomb blasting, bullet shooting, gun shooting, okay, motorcycle accident. We talked about domestic violence. There's quite a large number that had drowning accident as well. And people are not aware a drowning accident is a traumatic brain injury. When you have an hypotensive injury, when air and nutrients are not sufficiently delivered to the brain in a critical window of time, so the person can have minimal brain damage from it. The new thing in America is neurotoxicity that comes from working in nail salon in the beauty industry for a long time. Yeah. Okay. So the type of traumatic brain injury that we see in our office, people that have open head injury, they have gunshot wound to the head, they have penetration of the skull. I have a lot of people that still have bullet fragments inside of their body that inoperable. Closed head injury is very prevalent in terms of falls, assault, abuse. They have focal damage, which is a local damage to the skull. Some of them have loss of consciousness, and some of them does not lose consciousness, but it doesn't mean anything. Okay, you still going to have neurological consequence when one of these things happen to you. Diffuse axonal injury is what I'm talking about. When the brain is being slammed back and forth in the skull, and it causing the long fragile nerve cell to stress or tear. So if you grab a woman hair or child hair, you spin it around, okay, the woman does not have any bruise, any kind of visible injury, but now she has brain damage. She can go into a coma because the internal structure of the brain, the consistency of the brain is like jello or tofu. So when the brain is being spun around or when it being hit really hard, the brain bounces forward and then rebounds backward. So you have what is called bilateral contusion. You have bruises on both sides of the brain, okay? And that affects neurological function, thought, emotion, memory, all of that, okay? You can also have an hypoxic injury from drowning when oxygen and nutrients cannot deliver to the brain in critical window of time, okay? You can have a chemical and toxic injury, poisonous and toxic agents. When you inhale it, when you work in the environment, it absorbs into the brain, it alters the neurochemical inside of the brain, and it creates what is called a chemical injury. The effects of TBI, the short-term effect is that people will have post-traumatic amnesia or disorientation, not remembering the trauma or personal information. This is when somebody you see in a car accident, they can get out of the car accident and they can direct in traffic. You know, they can act perfectly normal. And then you ask them, what is your name? Don't remember. How did it happen? I don't know. Where's your address? I don't know. So these kind of amnesia, it can last from 6 months to a year, but then it may have lifetime effect anyway, okay? So person with post-concussion syndrome, which is mean there's a sharp force beating on the head. They can have, just like in football player, in soccer, in any kind of sporting event, when the ball hits your head really hard, you can have headache, you can have dizziness, you can have double vision, you can have tinnitus, you can have cloudy mind, you can have irritability, inattentiveness, short-term memory loss, information processing deficit, You can have noise and light, sensitivity, fatigue, sleep difficulty. Okay. TBI long-term side effect. Okay. So this is what the government is stuck with. In terms of when somebody has a brain injury, they say, well, this person has a brain injury 20 years ago. Okay. Well, a brain injury is a brain injury. It's like a pregnancy. You know, you're either pregnant or you're not. You cannot be just a little bit pregnant, okay? So when you have a TBI 20 years ago, it means you have a 20 years old injury. It doesn't go away. The symptom can subside over time, but with stress and with aging, the brain gradually get worse, okay? So people can have what is called mild cognitive impairment. The psychiatric system in America classify mild cognitive impairment is between normal cognition and major neurological disorder, such as Alzheimer's. Okay, so the term is tricky. When you say mild, that means, oh, you know, you don't have it seriously enough. But it is very serious. Patient may show intact activities of daily functioning. However, impairment is marked in short-term memory loss, information processing skill. They cannot remember words, faces, street name. They can't study, and they can't retain new information. Okay. They can have amnestic disorder. Amnestic disorder divides up into 3 categories. You have retrograde amnesia, or the loss of memories previously established. Okay, so for example, person has an impact injury to their head. They come out of it, and they can't remember what they ate yesterday. They can't remember what they did last week. So that is called retrograde amnesia. And then a person come out of a brain injury, they can have anterograde amnesia. They lost the ability to create new memory. This is very prevalent in the Vietnamese community. So they can remember everything like yesterday, 10 years ago, but they can't remember what they ate this morning. They can't remember who they talked to today. They can't remember to take their medication or go to appointment. So the little essential things in a daily life process, they can remember. They also have the loss of the ability to learn new information. So this is a very real medical condition. Okay? On top of that, they're going to have depression, anxiety, and sleep disorder is very prevalent in people with traumatic brain injury, because your brain wave has been altered and it turned chaotic. So you cannot go into delta wave and alpha wave and have a restful sleep. Okay, so we have a lot of patients come in, and they worked in the nail salon extensively for decades. And they have memory dysfunction. They have information processing dysfunction. They couldn't remember, how to cook. They couldn't remember to navigate the street. And a lot of them have to hire people to drive for them because they couldn't remember how to drive, okay? And the government want to know that what is working in the nail salon have to do with memory dysfunction. All right, so there are extensive research coming out recently. OSHA, the U.S. Occupational Safety and Health Administration, says workplace safety standard cited a laundry list of chemicals that nail salon workers encounter daily. Okay? The report aggregates decades of research on the incidence of those health problems in the beauty care workforce. They include a disproportionate amount of cancer, neurological diseases such as dementia, depression, immune disease, birth defects. One of my friends, she had 3 miscarriages working in the nail salon, and finally, people have to convince her to quit before she can conceive again. Okay? Reproductive disorder include a high rate of miscarriages, skin diseases, asthma, other breathing problems, as the workers are exposed to chemicals such as formaldehyde, toluene, methacrylic acid, phenylethylamine, ammonium phosphate, which are often found in the airs of the salon. It's inhaled, you inhaled it, but it also permeates through your skin as well. Formaldehyde is used in nail salon and nail hardener. So this is the stuff they use in embalmment of dead body. Study indicate they can cause cancer. They irritate the eye, skin, throat. They cause chronic coughing, allergic reaction, asthma-like attack, or difficulty breathing. Okay, and a lot of these substances have been shown to decrease performance on short-term memory tests. Okay? So we submitted these kind of research to the government along with the medical disability waiver to increase awareness and to help them to understand the reason why we have so many nail salon workers with memory disorder. The other thing they asked, okay, if you can work in the nail salon, you make a good income, you can feed your family, why can't you study for the test? Okay? So we tried to explain to the government, working in the nail salon requires procedural memory. Procedural memory is a part of the long-term memory that is responsible for knowing how to do things, such as motor skills, such as things that you conducted automatically, such as walking, talking, or riding a bike. Procedural memory does not require conscious thoughts, therefore it's called implicit memory. While studying for the citizenship exam requires declarative memory or explicit memory, it consists of facts or events that must be consciously recalled. Declarative memory requires intact attention span, working memory, information processing skill, such as comprehending and encoding, as well as a good memory for retrieving and recalling as well. Okay? So 2 different parts of the brain at work. If the person can do really well in factory, they can do really well in the assembly line, they can do really well in the nail salon, in the beauty industry, but they can't study, it's because 2 different parts of the brain is involved, 2 different types of memories are involved. The other part that the government is also troubled by is that there are a significant number of patients that apply in for the citizenship or illiterate. So the government say, what does an impoverished fund of knowledge or illiteracy in one mother language have to do with one ability to learn or study for the citizenship exam in English? Okay, so you would think this is conventional wisdom. Illiteracy is painful. It is a deep-rooted shame to a person's heritage and humanity. Okay, they're not proud to let people know about their illiteracy. Okay, the reason why there's so many immigrants that are illiterate in Vietnam, well, you look at a 50 years war, civil war. Okay, wartime disruption is disrupt with their educational process. Poverty, is the other reason. A lot of our patients couldn't complete the first grade because if they can walk and talk, they can stop working for the family. So the family would pull them out and make them work in the flea market on the street to help out with their 7 or 8 siblings. Okay, so a lot of them were not able to complete their education. Some family, they don't value female education, so a lot of our female patients are being pulled out of school. They were told that they don't need to study any further than first or second grades. They can recognize words, that's good enough, okay? A lot of them had learning disability, and a lot of them had neurological deficits. That's why they quit school. You know, they had drowning accident, they had motorcycle accident, they couldn't follow through in class. They repeatedly failed, so they just quit going to school, okay? Learning a new language requires a basic language proficiency in the mother tongue, okay? So within the first 6 years supply, your mother language is sealed inside of you, and learning another language requires a strong foundation of the initial language. Then you can build the new language on top of the other language. Person with an impoverished fund of knowledge in their language, they will most likely not able to grasp concept in U.S. history and civil exam. Okay. The other thing is psychological factors such as fear, anxiety, shame can be very overpowering in learning a new language, okay? And I want to remind it that only 1/3 of Americans, US-born America, passed the US history test, okay? So this is a recent survey, which is pretty interesting, okay? If you're talking about the U.S. civil test, you're talking about the 13th Amendment, the Bills of Rights, you know, the Civil War, you know, who's the president during the Civil War, things like that. Only 1/3 of Americans can pass the test. So if you can imagine an illiterate person, okay, with their feet wet on this land, just learning to resettle in this land, you expect for them to learn this information. Even though they're law-abiding citizen, even though they're hard worker, they're taxpayer citizen, they're making profit for the land, they still cannot pass the citizen, and their illiteracy is being held against them. All right, the other thing that the government also asks, what does depression, anxiety, PTSD, or being a victim of domestic violence have to do with memory loss, okay? There are countless research out there that talk about depression has been linked to memory problems such as forgetfulness, confusion. It can also make it difficult to focus on work or other tasks, making decisions or think clearly. Stress and anxiety can also lead to poor memory. Okay. Depression is associated with short-term memory loss. It does not affect other types of memory, such as long-term memory and procedural memory, which control motor skill. So this is a part that the government needs to be clarified. Okay. Person can do good work at their work, but they cannot study, or they're depressed, they cannot study based on this matter. Okay. A lot of time the government also asks, what does PTSD have to do with memory loss? All they have to do is just look up the literature, okay? PTSD is a very severe human condition. You would not wish that, you would not want that. Okay, a person's brain who has been traumatized is permanently altered. Okay, there's a cascade of chemical that alter their brain functioning and lead to neurological injury. Okay. You have a reduced acetylcholine, which is the agent that's responsible for arousal, attention, memory, and motivation. You have depleted opioid receptors that lead to apathy, frontal lobe adynamia, reduced social learning. You have an overactive adrenocortical hormone fight or flight response. You have enormous amount of cortisol in your body at all time, even the trauma no longer existed. Okay, so the fight or flight response is known for the freezing effect, the concept of the deer in front of the light. So when the deer is in front of the light, it's shut down, the verbal center is shutting down, and that's the reason why person with this chronic overactive stressed system, their verbal center is impaired, so they're unable to learn new concept and new information for that reason. Okay. So this is the brain of a person, a normal person, and this is the brain of a PTSD person. So you can see that the brain of the PTSD person is shrinkage very visibly. Activities are very much confined, where the brain of a normal person is very flourished, have a lot of movement. So with PTSD brain, the hippocampus, the learning center of the brain, became shrinkage over time. The amygdala, or the emotional center, the trauma center of the brain, is enlarged. The amygdala is like the alarm clock of the brain. It constantly sounds off, even though trauma is 20 years ago, there's no burglary in the house, it's constantly sound off. And so with this chronic condition, it impedes learning and it impairs memory for that reason. Okay, so coming down to what the presentation today is all about, okay? The enormous frustration of the Vietnamese immigrants with the INS, with the constantly turning down of medical doctor waivers or psychologists or clinician disability waiver for the patients. We get tons of the report returned back to us because the officer, the people that interview our patient, didn't understand what the doctors mean. So these are some of the real returning question to us. They would ask us, what does intact daily functioning means? Okay. Is that a reason to fail the patient because you don't understand what intact daily functioning means? So it basically means the person can take care of their personal hygiene, they can brush their teeth, they can comb their hair, they can prepare a meal for themselves, but they get lost on the street. They may even get lost in their own neighborhood. They don't remember the day, the time, who's the president of the United States. They don't know what 911 means. Okay, they don't know what to do when there's an emergency. They don't know how to call 911. Okay, and then we got things like, what did neuropsychological sequela mean? Okay, and we literally had officer Google the meaning of it, and they say, well, what it say here on Google doesn't match with what the doctors say. Well, Google definition is for layman. Okay. So sequela means something else in medical language, okay? So we don't expect for everybody to know this terminology, but for the officer to fail our patient and turn them out because they're not able to understand what the doctor said, is very hurtful for the Vietnamese population. And then we have things returned back to us that say, what do you mean by impoverished intellectual functioning? Okay, so things like that, okay, which is mean the person is illiterate, person dropped out in the first, second grade, the person didn't finish their formal education. Okay, so we have officers there Google in symptoms and even medication to see, okay, you have dementia, okay, what medication you are taking? Okay, so is it medication for dementia? Okay, come on, okay. And then one of the very shocking things that they even perform neurocognitive testing on patients without training, okay. So a patient came in, patient have early stage of Alzheimer's, okay. So they sat the patient down and they took out money. They say, do you know what this money is? So the patient say, yes sir, that's a $20 bill. Okay, do you know what bill is this? Yes sir, that's a $10 bill. You don't have dementia, you don't have Alzheimer's, they fail the patient. Okay, so number one, Alzheimer's comes in stages. Okay, the very first stage is that you lose grasp with reality. You lose your short-term memory first before you lose your long-term memory. Memory is something you knew when you were a child. Okay, you're not going to lose that concept. Okay, you're not going to lose the concept of how to eat, how to turn on the TV. Okay, those are procedural memory, those are long-term memory. Okay, but your short-term memory, your ability to study on a daily basis, to learn new concept is impaired. The officer who are not trained medical professionals should never perform this kind of testing on the patient. They should never discredit doctor report and test the patient as such. Okay, especially when they don't know about Alzheimer's, they don't know about memory dysfunction. And doing this is such an humiliation to our patient. Turning them out because they can recognize the $20 bills, that means they should be able to study for the citizenship exam. Okay. All right, so how do we work together between doctors, patients, INS officers to help our people to become legal, legitimate U.S. citizens? These are law-abiding, upstanding citizens. These are people who pay taxes, who work very, very hard on a daily basis, but they couldn't come into the door of America. The Liberty Bell stopped and not ringing for them because of the myriad of problems that we have here at the portal gate with INS. Okay, so my recommendation from the bottom of my heart is that the government have to have equal treatment to all doctors trained in the United States, regardless of their ethnic groups. So when they see a Vietnamese doctor's name, okay, they immediately shove the patient out. I have patients that they don't even read the medical waiver. They went ahead and tossed it out and told the patient, no, you have to study for the test. We are not going to accept this doctor disability waiver. Okay. Well, just a gentle reminder, all of us are trained in the United States, okay? All of our licenses are warranted by the state of Texas. So a medical waiver that came from a Vietnamese doctor, a Filipino doctor, an African-American doctor, a white doctor, all are licensed by the same government. So need to be treated equally, okay? We would suggest to have a medical professional review the disability waiver and interview the patient instead of untrained personnel. Okay, so in all fairness, we don't expect for everybody to be able to read the medical disability report, understand all of the terminology, understand about brain injury, understand about post-traumatic stress, understand about procedural memory versus implicit, explicit memory. Okay, but to be fair, we need to have somebody on the other end of the table that being able to understand this and not toss out medical disability report because they can't understand it. Okay? We would suggest the government to have a court-designated physician or psychologist examine the patient if they mistrust outside doctor. You know, go ahead and do it the way that the SSI do, which is they have a court doctor evaluate the patient, then the court doctor, the court designated doctor, can warrant the medical disability. If you allow for medical doctor from the outside or psychologist from the outside to certify the medical report, you have to treat all doctors the same way, and you have to be respectful and to be convinced of the medical report. We operated under our licensures. With all of the money in the world, we don't want to risk our licensure for anything, okay? And we are not overcharging the patients. We charge them the same price like all other ethnic groups that come to us, okay? The other thing they can also have is to have a camera in the interview room to reduce personal bias or mistreatment toward the patient, okay? So we have patients that came out of there crying, were completely demoralized because their doctor report was not even read. They look at the doctor, they say, oh, this is a Vietnamese doctor? No, we're not gonna accept. Okay, because this doctor have certified a lot of patients. So very much like this doctor has a lot of patients with flu. So we're not going to believe that you had the flu. Okay, so with that in saying, I respectfully want to voice my feelings based on my experience with all of my patients here in Houston, Texas. I hope the government would have increased awareness and providing a working relationship with doctors to bring good, legitimate, hardworking people to become U.S. citizens, which is the founding principle of our fathers in this land has emphasized it. This is the country of immigrants. We need to make it as dependable for them as they are dependable workers for us. Thank you so much for your time. God bless.